Hi, I'm Dr. Santhosh Bethur. I am a consultant in Department of Urology at Aster RV Hospital, Bangalore.
Hello everyone, I am Dr. Caranj. I'm the consultant in Urology and Renal Transplant in Aster RV Hospital, JP Nagar, Bangalore.
Dr. Karanj, today I
So,
think we will talk about a broad topic where we discuss about what are the common symptoms for which one visits the urology clinic.
clinic.
Okay, so can you just briefly tell us about?
So, nowadays, what we are seeing in our office or in the urology OPD is nowadays we are seeing a wide range of patients. We have a subset of patients that typically the aged patients who come with their chronic urological ailments like prostate issues or with UTI, chronic UTIs. Then we have a new subset of people, young patients, both male and female, who early 20s, late 20s, who come with a very vague complaints or specific complaints like pain, discomfort, pelvic pain, more complicated or more newer things like pelvic pain syndrome. So it's a wide range. It's not a
Yeah, so
one subset of people, but we are seeing a wide
wide
range
range of.
of patients,
So
right from
it's different for younger patients and
patients,
it's for older patients.
right from adolescents to old age.
Old age. Okay,
We are
okay.
seeing a wide range. So, in adolescence, what do you feel, sir? In young patients or in young male and female, what are the common complaints that you see?
So in our clinic, I mean, the symptoms sometimes it may be as same as in the old age, like difficulty in passing urine. So they will, the most common reason is like frequent urination and sometimes pain while passing urine. Some of these patients come to us when they see some blood in the urine. So these are all the common symptoms, but unlike in old age, these people, the young people, will not have significant disease as such. I mean, not that they cannot have, but in generally, the diagnosis is a simple diagnosis like urinary tract infection. But the same symptoms in old age, we have to evaluate in a different way because the possibility of having some serious illness is more in older patients. And in younger patients, yeah, the symptoms are disproportionately more, but the diagnosis is a simple one. So, what do you see as a more common urinary symptom in like we see a lot of male patients in
Yes, sir.
general is
Nowadays, we're
old
seeing
age.
a lot of prostatitis patients, acute and chronic prostatitis, then a lot of varicocele patients, patients with complaining of dull aching pain, long-term pain, which requires further investigations, further examination, and if required, treatment and sometimes surgery also.
So, how do we go about it? Like when they come to us in our clinic, so with the common symptoms are either we can divide it into simple things
So,
like urinary tract symptoms like difficulty in passing urine, burning sensation, or sometimes fever, or somebody can come with a pain abdomen, which can be quite severe or can be a dull aching pain. So, how do you go about it after this? You take all these histories.
So usually any patient coming to our clinic, the first most important thing is a thorough history because that itself will give us a light of or a direction as to what probably this patient is suffering. So first a thorough history, listening to what the patient has to say, followed by a thorough clinical examination in the OPD. I think so is what is the still the mainstay of any treatment in urology. Next, based on how the patient has his symptoms or what he says are his complaints, based on that, we will might have to do certain investigations, certain blood tests, certain urine tests, certain radiological investigations like ultrasound. We even have a bedside ultrasound in our OPD, which we use to just to check for any minor issues. Or if required, we can also get an ultrasound by the radiologist. Or sometimes if it is more of a colicky pain where you're suspecting renal stones, then a CT might be warranted in such patients. Then blood tests to rule out other issues like the renal function test, the prostate specific antigen.
So one of the common concerns our patients do have is sometimes they come to our clinic and usually we run a battery of
Okay.
tests. Okay, sometimes these are the common people, the concern people have. Why do we need so many
Yes.
investigations and why do we need an expensive investigation like a CT scan and ultrasound? Can you tell something about the?
Yes, sir.
Uh,
So again, as I mentioned, history and the clinical examination still the mainstay. But nowadays we have with the improved diagnostics, with the improved radiology, And certain times we might or we should go for certain tests, because we have to have a definitive diagnosis before we come to any conclusion or start any treatment for the patient. For example, history of any kidney stones or any colicky pain. So diagnosis of any renal stones or any ureteric stones is purely, it is a radiological
Investigations.
investigation based diagnosis. And as you know, sir, many stones might not be visible in ultrasound, or small stones less than 4 millimeter might be missed in an ultrasound. So that is why we consider the CT KUB, that is the CT kidney ureter bladder, as the investigation of choice in patients with
So the accurate diagnosis is very important for
yes, sir.
giving a proper treatment.
Yes,
As you mentioned, that CT scan, it is practically considered as a gold standard in diagnosis of stones. Whatever we see on the CT, there cannot be no second opinion about what we see in the CT. Unlike ultrasound, ultrasound is a subjective investigation.
yes,
Like it depends on the machine which they have. Sometimes it's about the skill of the radiologist. So it's quite subjective. So what we suggest is not to spend more money, but sometimes when we diagnose it properly, the treatment can be cheaper.
yes,
Like
sir.
if ultrasound says there is a big stone, but we don't know exactly. If CT scan says it's a small stone which can be managed with the medication,
Conservative management.
yes, we can definitely do a proper treatment where we can save more money for the patient and giving an accurate diagnosis.
Yes, sir.
So as the time evolve or the technologies evolve, instead of the people spending more money running behind investigations and going from one doctor to other in searching for a diagnosis, one proper investigation can solve the problem in at one place.
Yeah.
So after investigation, when we do a diagnosis, we what we see is the common diagnosis in our urology clinic is two most common things we see. In men, usually it is a prostate enlargement, especially in older men, and the second is stones. In case of women, it is usually urinary tract infection and stones.
Yes.
So, how has the changes evolved in urology department, like from last 20 years? How the technology has changed the management in our treatment of these
Yes, sir.
patients?
I should say that it has evolved a lot and is also evolving. It is a constant process and it is happening very fast. So, first coming to stones, sir. Stones over the last 20 years, first there was lithotripsy or external shockwave lithotripsy, which was considered gold standard 30, 40 years ago. Then came intracorporeal lithotripsy or URSL, which was also considered good, say 10, 15 years ago. Then was with the onset of lasers, we have now multiple lasers. Then we have finer instruments, we have endoscopes, we have miniature scopes, we even have flexible scopes nowadays, which can reach all the way up to the kidney endoscopically with and accessing all the parts of the kidney. So all stones less than 15 millimeter, we can address through that. And nowadays the lasers are so advanced. You have the holmium laser, the thulium laser, that even however hard the stone is, you'll be able to fragment the stone without any difficulty.
Yes, as you mentioned, I remember our 25 years back or 20 years back, we used to make a big incision to remove a small stone, like
Stone.
5 millimeter stone. Nowadays, it's practically like an half a day procedure in the
Yes, sir.
hospital.
Where the patient comes in the morning, undergoes the surgery, and by late evening, the patient is discharged.
So, as you mentioned, because of the evolving technologies, it has made the treatment simple.
Yes,
Most of these patients for the stone disease, practically the hospital stay is at maximum 1 day
one day,
or less than
maximum
one
one day,
day in
sir.
the hospital, and immediately they can get back to their day-to-day work.
Work.
So definitely technology, even though sometimes people feel that uh, at one point it may be expensive, but in an overall scenario, it will save the number of
Days,
days of
yes, sir.
admission.
Like sometimes people take 1 week of conservative management.
Correct, correct.
Instead of that, one day finishing everything in one day and going would be much more economical and meaningful for them.
Correct. So in a country
Uh,
like in India, where the man hours wasted from away from the work is tremendously high for many of these illnesses. So these treatment have actually made it possible that patient can return back to their work within a day or
day,
two.
yes.
Okay. Dr. Karans, can you tell me something about the things which we use in the management of
So,
prostate enlargement?
so as everyone knows, prostate enlargement is a very common condition that we see, all men above 60, 65 years. It's an age related process of benign enlargement of the prostate. So for that, the gold standard considered was TURP, or transurethral resection of prostate, but that had certain side effects or complications of it, like stricture formation. There was increased bleeding during the surgeries, or hematuria. It required longer hospital stays, and previously when we were using glycine, so it was leading to complications. So now the latest, sir, is the, as we all know, is the laser, the 100-watt holmium laser. So what it does is we are doing the complete enucleation of the prostate. So, however large a prostate it is, we can do it in one sitting. Previously, if it was a very large prostate, we were staging the procedure. So now it is being done in one sitting. And since we are not using glycine anymore, it is much safer. Even patients with cardiac issues, on all such patients, can safely undergo the procedure. And most importantly, again, the same thing, the hospitalization, the stay has reduced. Previously, PURP, you needed irrigation for 1 or 2 days. After that, catheter removal after 2 or 3 days. So patient roughly had to stay in the hospital for 4 to 5 days. Nowadays, for prostate patients, 1 day or maximum it is 2 days for patients who are undergoing HOLEP, that is the holmium laser enucleation of prostate.
So
But
the what used to be more than a week or more than
yes, sir,
2 weeks of treatment and hospital stay, it has reduced to practically two
one
to
or two
three
days.
days stay
Yes,
in the hospital. So at the same time, it has given a good result.
yes, sir.
And yes, as you said, so technological advancements have definitely improved the patient outcomes. It's good for the treating doctor as well as the patients. So a little bit of female urology, which we many times, many of the women we see in our clinics, the most common reason we see is urinary tract infection. But a small subset of women, or in fact, many of these women, they come to us with something called incontinence of urine,
Yes,
or we call this involuntary leakage of urine. I feel it is not addressed properly, or many women are shy to come to the doctors and seek treatment. So, can you tell us a few things about whether is there a treatment option available for these patients?
yes, sir. So women, especially aged women, sir. So among them, urinary incontinence is a quite a common issue, especially stress urinary incontinence, sir. So for stress urinary incontinence, it sometimes it is quite severe. So it affects the social life of the patient. There is a social stigma. They are not able to go outside. There is a fear or a phobia among them. So such patients, all these years, previously due to lack of awareness and availability of
Hmm.
healthcare, they were bearing with it, and they were suffering all these days. So now it should be broadly put out in the society that patients who are suffering from stress urinary incontinence can get rid of that problem by a small procedure, sir, what is known as a sling surgery, a transvaginal sling surgery, which would help them in completely controlling their leak, and then they'll be able to lead a very normal life. Same, it is a very small procedure where there hardly 1 or 2 days of hospitalization is required. So by getting that procedure, they are going to lead a very happy life instead of suffering silently.
So the first important step is to accept that there is a problem,
Problem
and
and
yeah, go to a urologist and take a treatment,
treatment.
which
Yes, sir.
is, I mean, this is not a normal thing to have.
Yeah.
Briefly, I mean, we can summarize that. So most of these urological conditions are very common. It's one of the most common symptom one can have in their lifetime. Almost everybody will require a urologist at some point of their life. Uh, most of the things, most of the symptoms, there is a simple explanation. Most of these requires a simple treatment like tablets, antibiotics, or painkillers. Even if they require surgical management, we have got a good technologies, minimal invasive procedures, and the shorter hospital stay, lesser cost, in fact, early return to their day-to-day work or the official works. So, in generally, the one on one side, the medical improvement, the science, the understanding the problem, the technological advancement with respect to the instruments and diagnosis. So all have improved the total patient outcome. So what I feel is that uh, don't hesitate to take a
Yes, sir.
treatment.
Because all these surgeries are like having near to 100% results, very good outcomes, and easily accessible, available every year, especially with us in Astra. We have all this. So anyone who is suffering any urological problems I don't think nowadays is a time where they should silently suffer with it. They should make use of the available opportunities and get treated and lead a happy or a normal
Right.
and a dignified life.
Yeah. So thank you, Dr. Karens. A small message to our patients. We discussed, it's a broad discussion about these symptoms. If any of you were watching these symptoms, I mean, you can take a treatment from any urologist available to you close to your house or close to your place, or you can meet us at Aster RV Hospital, Bangalore, JP Nagar.